the beginning. Right, okay. So what's going on in the NHS in 2020? This is probably a much longer presentation than I can actually do tonight, so I will be skipping some of the slides to try and fit it into the time we've got available. But we are at a really crucial point when it comes to what's happening in the NHS at this moment. And obviously it's worth saying that we support the 15% pay rise for NHS workers, or whatever figure they decide they're going to go on, and that it's more important than ever in this time of pandemic that we have an effective and efficient NHS open to everyone, and not having it that whole chunks of people who are migrants can't access the NHS. In Liverpool, when they were trying to really get people to go and get tested, they very specifically said, you don't need an NHS number, you don't need anything, just go and get tested. And it was very, very successful. But if you think that you're going to be chucked out the country if you go and get a test for COVID, then the testing isn't going to work. Anyway, so that's the start, that's the introduction, if you like. So what do we mean by privatisation in the NHS? It's businesses making big money from the NHS. It's not yet people paying for their own treatment, either by self-pay or health insurance, but that's creeping in. The privatisation is companies making private profit from the NHS and breaking up the national service, all happening at increasing speed. It started, of course, in Thatcher's time with the outsourcing of cleaning, which led in turn to the MRSA outbursts in the outbreaks in the hospitals. There was the privatisation of elder care in Thatcher's time as well, and the beginning of this massive reduction in beds in the NHS. If you want to read more about, if you're lucky enough not to have lived through Thatcher and you want to read more about what she thought, there's a famous report called the Mackenzie Report. But more recently, we've had PFI, Private Finance Initiative, outsourcing and commissioning of for-profit services for providers. The 2012 Health and Social Care Act escalated it all. And by 1819, NHS commissioners were spending 9.2 billion on services delivered by the private sector, also referred to as the independent sector. The private sector has again and again failed. The classic is at the Hitchinbrook Hospital, which they took over saying they'd show us how private could be much better than the NHS, and they ended up having to give the hospital back to the NHS because they couldn't run it. Migrants are already charged for or denied healthcare. Not all migrants, but a substantial number. In the Windrush scandal, people who'd lived here, often worked in the NHS, were denied care, and that led to various deaths. There's been three well, they're not named publicly, but 3 named women have died because they were denied free NHS maternity care. And this is the music of the future for all of us. It's the privatisation we've had so far has included massive outsourcing of health service workers with worse pay and conditions. And we've all been out campaigning against it. I'm sure everyone here has been out campaigning against it. This is going over the very basics of why we need healthcare, because these ideas are dismissed by the Tories and we have to keep pushing them. Human life in early cities was nasty, brutish and short. Life expectancy very short. It began to change in the 18th century, and by now it's 81 years in this country, contrast to Namibia's 63. But to keep it there, germs and viruses, dysentery, cholera, typhoid, malaria, syphilis, AIDS, SARS, Ebola, dengue fever, TB, many more are still dangers to us and have to be controlled. And further new viruses are expected. Cities can improve or damage life expectancy and quality of life. And now most humans live in cities. Healthcare is essential, not just doctors, midwives, nurses, health scientists and the linked professions, but public health, sewers, water supply. They are essential for civilization. And the NHS was not given to us by well-off do-gooders, but fought for by the Labour movement for decades before it was won. Nye Bevan MP pushed the legislation through Parliament and made it a reality. And it's the gift to us from those who defeated fascism and those who worked for women's rights right from the start of the last century. Internationally, there's three models of healthcare provision: self-pay or insurance policies, as in the USA, with millions left without healthcare, casually left without healthcare. But collecting insurance and checking entitlement and limiting entitlement all costs a lot of money. America spends a lot more than we do on healthcare and yet can't support all of its people, a lot more per head of population, and yet can't support its own people. Social insurance in Germany, they also spend more than we do, and there are issues of entitlement there as well, and it's expensive to operate, but it's pretty close to a universal system. And then there's universal healthcare, as we've got in the UK. And the universal healthcare system was ranked first out of 11 developed countries for efficiency in 2013. And that wasn't the first time. It's a standardly accepted in healthcare politics that the NHS model is effective and efficient. It's not an added extra. It's really important to people's lives that we have proper healthcare, and it makes the country richer. Having people get better from being ill and stopping them getting ill makes the country richer. So it's an investment to pay for healthcare. And the key pillars from the NHS are: it's free at the point of need, it's a universal service, a national service, so the risk is shared. In those tens of millions of people share all the risks, and all the components work together. It's supposed to provide the best available treatment, not a second-class one. It should be funded fully by the government. It's not for profit. It's a research organisation. It's linked to public health, and it's the sole purchaser of goods and medicines, and therefore creates price efficiencies. Just another reminder that ordinary people fought for healthcare. This is Kitty Wilkinson, who helped defeat cholera in Liverpool. She had a boiler in her basement and allowed her neighbours to come and boil their soiled lawn, their soiled sheets in her boiler, so that the diseases could be boiled out of them. And later went on to set up, after the cholera, she went on to set up wash houses right the way through Liverpool.
Felicity,
the NHS, yeah.
Are you thinking that your PowerPoint is showing at the moment?
Yeah.
It's not.
Oh, excuse my Greek. Okay, let's escape and see what we can do. Share screen. Where are we? Sorry, I'm going to have to get it up again and then go back into share screen.
Okay.
Life was much easier when we had chalk and talk. We had
it was a bit, wasn't it? It was. Let's see. Why is this not working?
Do you actually need it, Felicity?
I need it for the notes, if nothing else. Can you give me 2 minutes while I just see, can I make this work?
Of course I can.
I don't know why. Something gone strange.
It's one of those days. Brilliant.
Sorry, I wouldn't have galloped through if I thought you couldn't see it. Okay, so let me see, can I go back to this one? I'm not going to actually go back to the beginning. I'm just going to gallop through. Okay, so I'll start at this one. So most people know that we've lost a huge amount of mental health care, and that basically the provision is now in vast numbers, vast swathes of it is provided by private sector. And some of you will have been at a big meeting last time the world transformed was in Liverpool, where a mental health nurse was saying that he the previous night had to put a woman in a car just with the taxi driver, not with the nurse, to drive all the way from Plymouth up to Manchester to find a mental health bed. The situation in mental health is dreadful, particularly for children, and huge amounts of money are now being paid by the NHS to the private sector for the provision because NHS provision has gone. Hospitals became trusts in 1990 and foundation trusts from 2004. And the idea was that these individual hospitals would each have their own budget, have to balance their accounts, and they ran around like headless chickens trying to manage them. In the campaign I'm most closely involved in, the Save Liverpool Women's Hospital, it was a ridiculous, they simply could not afford to do the job they had to do on the money that was provided for them. We did improve somewhat during our campaign. We're not claiming full benefit, but it certainly was one of the pressures that got them some more money. But NHS debts of 13.4 billion, hospitals owing to the government, 13.4 billion were written off at the start of the pandemic. We're obviously pleased those debts were written off, but we need a better system. The other debt that needs writing off is the PFI. And I'm skipping through this, but Bart's Hospital, for example, has a staggering 4.5 billion to pay in its for its PFI build. Liverpool escaped simply because the hospital was not finished, so the contract not completed. Otherwise, as well as having a brand new but not working hospital, we would have a PFI debt as well. Now, the real problems start, well, the most serious problems start in 2012 with the Health and Social Care Act. They created the clinical commissioning groups. They were ostensibly run by GPs, but advised by big business. And they were commissioned services from private companies like Virgin and third sector things like Barnardo's. And they set up the healthcare scrutiny committees on the council. It involved breaking up national patterns of health provision. The CCGs are set up to purchase, commission local healthcare in your area, and they were made by a further legislation. They had to use competition to do it. Been huge cuts in the number of beds, no reduction in demand. The UK's got fewer doctors per head of population than other countries in Europe, and the number of doctors trained is a government decision and one they've got very wrong. So too few beds, too few doctors. And they're now outsourcing clinical work to the private sector and diagnostics. Diagnostics is a huge one, and the diagnostic firms took 5 CCGs to court when they were awarded the contract to another company. And private involvement is set to expand with the NHS plans for 150 diagnostic hubs, which are likely to be run privately. People won't be charged for them, yeah, but they're privately owned. Now, health campaigners warned in 2012 and in 2015, this talk of integration. It's a buzzword, but the NHS is the most integrated service with integrated national clinical standards, nationally recommended treatments, national accountability, integrated funding, integrated methods of allocating resources, and an integrated system of paying conditions for staff. If we're going to get it back, it's going to need basically the renationalisation of the NHS. Now, just about everyone who seriously studies the NHS knows that the ICS version, the STP version, sorry, I'll start that again. Everyone now accepts that the commissioning version of privatisation has created chaos, the CCG version, both in the hospitals and nationally. But this new form of privatisation based around STPs or ACOs or ICSs, whichever we call it, the breaking up of the NHS into 44 areas, that is yet another system of privatisation. All the CCGs are going to merge to match the STP model. Our STP is Merseyside and Cheshire. We've already had the merger of the Cheshire CCGs, and Simon Stevens is pushing hard for it to be one CCG for Merseyside and Cheshire. Sometimes the STP or the ACO or the ICS is also called Integrated Care Partnership. It's the same thing. Now, despite the cuts in the NHS, there's still a huge amount of money comes into the NHS, and the big companies treat that like a honeypot. We're going to be spending 140 billion on healthcare, and lots of that is going to go to the private sector. Sorry. See, can I go back one? Sorry, I'm making a mess of it again. So what's going on? The NHS is a huge and successful organisation, considered the most cost-effective and successful health service in the world. It's a vast repository of medical research and data. A lot of that data has already been given away by this government. One of the biggest employers in the world and the largest employer of skilled workers. Huge amounts of money go from the government to the NHS. It's the largest single purchaser of drugs in the world and serves to restrict global prices. Profit seekers see it as a honeypot where they can make money, and the ideologues of profit hate it. So we've also got this thing of demand management. Who decides, can you be referred to the hospital? And that referral system is itself run in many cases by private companies. The GP can't make the decision. The management structure makes the decision, and that's run privately. The pandemic, it didn't have to be this way. Find, test, track, trace, isolate and support are long established fundamentals of fighting infectious diseases. It's been cut and privatised. My sister-in-law works for the New Zealand track and trace system. And she said the people who understood the system best when it first started were gay men, because they'd had it throughout the AIDS scandals and the AIDS epidemic. They knew how it worked. It works for infectious diseases. But in this country, it's been cut and privatised. The government's huge financial response has been used to divert resources from the NHS and from public health. Money's been spent on private hospital beds with no clarity as to who's used them, but it has put capital, heavy capital, into the private sector. The pre-planning exercise Cygnus was ignored. We went into the pandemic with too few beds, a shortage of nurses, shortage of midwives and other professionals, inadequate PPE and no effective track and trace system. But they took the opportunity to cancel the debts, not because they're being nice, but because they wanted to shift it again to this new system, the STP system. They said in a letter on the 31st of July that clinical commissioning groups must achieve financial balance within their ICS STP envelope. While systems will be expected to break even, individual organisations will be permitted to deliver surplus or deficit. Put crudely, this means Merseyside and Cheshire must cover all the costs of the healthcare in their area without going back to the government. That's not been possible before. I doubt it's possible now, but that's what they've been told to do. The propaganda that goes with the ACOs, ICSs is of health and social care working nicely together, being nice and kind and efficient. It's far from true, but that propaganda is powerful. Social care is not free at the point of need, nor is it a comprehensive service, nor is it necessarily publicly provided. The pressure from the NHS is going to be on for councils to fund social care, to stop bed blocking. Anyone who's been to one of the health and social care meetings hears that. And that could be pulling money away from other services. Funding has been granted at STP level for virtually everything since the pandemic started. I would like at the moment to stop at that point and see if people want to ask any questions, but I've got more to say after it.
Got a question here for you, Felicity. It's from Andy. Can you explain how repeat prescriptions might be dealt with when all these changes go through by April 2021? He understands that it would be done by a hub and not a doctor. Is that what's happening? That
is happening in some areas of the country already. That your doctor writes a prescription, it goes to a central area. The central area decides whether or not you can have it, and those central areas are likely to be run privately. The idea being to cut the costs. Everything is cut the costs. So I don't know if it's happening here yet. I know it's happening in some parts of Lancashire, but I don't know about whether it's happening here yet. But that's the model we're moving to. It's part of rationing. Yeah. And of course, you know, there's already lists of drugs you're allowed to be prescribed and those you're not.
One of the people we've actually got on the call at the moment is a councillor at CWAC, which is Adam. And there's a question here, which I want people to think about before either yourself, Felicity, answers it, or if even Adam answers it. It's from Linda, and she says that she understands that CWAC has seen this danger and not gone down the merger road. Now, the thing is that, can we talk about that at the end, please? So that Adam can have a say as a member of CWAC, and you can have a say as well.
Yeah.
What is happening about the cutting of different treatments which we can have? This is from Anne to everyone.
Do you want me to answer that?
Yes, please. Sorry, Felicity.
Yeah. Sorry. Yeah. No. I've got some stuff on this in the next couple of slides, but that's exactly what's happening. They are restricting treatment. They are rationing the treatment and saying, you know, some people can have this and some people can't. And they're saying certain things. They keep publishing longer and longer lists of treatments which are supposed to no longer be available, no longer to be necessary. And if I may, can I switch back to sharing the screen again and show you one screen on that? One shot on that. Now,
yeah.
2019, this was published. Now, to understand the importance of this, you've got to realise this is Warrington. Warrington's part of Cheshire and Merseyside, part of our STP area, part of the thing that we are directly involved in. They published this thing called My Choices. This was a list of operations which they were no longer going to fund, but you could buy from the NHS and it had the prices on it. For example, the revision of a hip replacement surgery was 8,400 and something. We raised Cain when we found it, and we had stalls all over the place, and the Daily Mirror picked it up. It became a national story, and they were forced to, I quote, pause it, not stop it, but pause it. The process of denying us certain treatments creates the market for the self-pay insurance style, and the beds to make that physically possible are now being, the private sector being given the money. They can still make profit from it to do that. So, and the woman who published this was senior in the Merseyside and Cheshire STP area that is already functioning and making major decisions about our care. So that in your head, you've got to have this idea. If people are trying to make money from it, they want to make money from the fact that large amounts of money go into the NHS. They want to be right there at the tap, catching the money as it comes out from the government and choosing how it's spent without us having a say on how it's spent. And this idea of rationing care either by saying you can't have this medicine, or you can't have this treatment, or you can only have one eye done if you've got cataracts, or you can only have one round of in vitro fertilization, and in another country, another area might say two. All of them, that's important. And the other thing is that instead of 60 or 70 million people all sharing their risks, that now it's going to be just the Merseyside and Cheshire area sharing the risks for the Merseyside and Cheshire population, which I know it's got rich areas in Cheshire, but if you think about Liverpool, Sefton, Knowsley, Ellesmere Port, Chester even, we're not talking about people with any money, and we're talking about poor care. You know, we'll be talking about poor care for those areas. Sorry, I'll try and stop screen sharing for a minute and go back to questions. I'll try and
what I want to do, Felicity, is that I would very much like to bring in Councillor Adam Langham, because Linda asked this question, and I will read the question to you again. And Adam has actually agreed to say what he knows as a CWAC councillor, and then maybe you could have your say to answer what Linda said. And Linda said that I understood that CWAC had seen this danger and not gone down the merger road. So can I pass this over to you, Adam?
Yeah, sure. To be honest, Felicity, you'll probably know more than me. I've been elected for a year, and as you well know, being a former councillor, the council is a massive beast, and especially healthcare is incredibly complex. So it's something that I'm not massively aware of, because I'm not on any scrutiny committee around health. I'm on people scrutiny, which is much more on social care and on sort of children in care and all that. So I know a lot more about that. But in terms of the actual, all the integrated partnerships and all that sort of stuff, to be honest, it's a bit of a maze. It's something that I hope in 3 years I'll know a lot more about when I finish. But it's something at this moment in time, there's other things I'm more interested in with the council. And just one question before you answer that one, well, as well as answering that one. It's a topic that I think if you spoke to vast majority of British people, the NHS polling wise is still immensely popular amongst vast majority of the populace, whether you be a voting Conservative or a Labour voter. So even if you're a voting Conservative, you will just basically say, well, it's not being privatised, it's still there, isn't it? We've been in government 10 years, it's still there. And I know they're doing it in a very shadowy way and they're doing it gradually. How do we, considering we just got absolutely destroyed in an election where Jeremy Corbyn had evidence that Donald Trump wanted the NHS on the table, how do we possibly win an election when doctors say vote Labour, when everyone in the NHS says vote Labour? People polling-wise love the NHS. Basically, the question is, how do we cut through?
Okay, thank you. I can screen share again to this one. As I said, this is a very long presentation, but you know, I'll switch to this. So what's the council in Cheshire West doing about it? When you talk to most councillors, they refer to the Cheshire West Integrated Care Partnership and think that's what we're talking about when we're talking about the Cheshire and Merseyside Health and Care Partnership. Now, don't be surprised that the two names are so close. The obfuscation and distortive propaganda is huge in the NHS. You've got to remember how much money is involved in this. The Cheshire has a Cheshire West Integrated Care Partnership. It is not the same thing as the Cheshire and Merseyside Healthcare Partnership. The Cheshire and Merseyside Healthcare Partnership is the ACO, the Accountable Care Organisation, the population funding thing that we were talking about a minute ago. That's the big thing. And to say the council are not taking part in it is frankly nonsense. They are one small, Cheshire West is one small part of the whole Cheshire thing, which has just merged. The CCGs have just merged. Some of us attended virtually. the first meeting of it. And at that meeting, they was amazed to find out that they can't actually stay just as Cheshire, that they've got to be merged with Merseyside as well. Merseyside don't want to be merged with Cheshire. Cheshire doesn't want to be merged with Merseyside, but that's what's happening. And the letter very specifically says that they've got to balance their books at an STP level. So the STP is physically happening now. It's sad that many councillors don't understand it. From the Trades Council, we have tried to explain it, but this is what's happening now. So, sorry, I've tried to go back to, hang on, this next one. Losing it. Sorry. I've got all my sources coming up now, so you can see where I got all my stuff. Come on. So the next section, the next one. No, I've lost it. Anyhow, I mean, there was a thing from the Defend Our NHS in the Wirral explaining how, and in many ways, the Wirral has been a pioneer for everything that's wrong, explaining how private, they set up a strategic group of the council, the NHS and the private companies. That is their strategic group making the decisions about the NHS. So it said, I'll quote it, the members of the strategic leadership group will be a senior level within their respective organisations and have the ability to make decisions and escalate issues as appropriate. They will ensure compliance with governance arrangements. Members will be responsible for disseminating information to and from their organisations. There you are, Neil McKay, Associate Partner, GE Healthcare, Finnemore, and Peter can't say his name, McCulloch, Senior Advisor, GE Healthcare, Finnemore Chair, Implementation Group. They are there already. Now, you know, Cheshire and Merseyside is huge. And one of the things I'm trying to do, and the Trades Council have been trying to do for a couple of years now, is to get all the campaigners for the NHS across Merseyside and Cheshire together for a big meeting so we can work in an organised, coordinated way. That's desperately important. I'll stop sharing at that point. So I'm happy to sit down and talk to Adam and any of the others and bring, bring people who are more au fait with this than I am. I'm a campaigner. There are people whose lives are basically organising this. We recently did a briefing on all of this for the Liverpool MPs. I have their permission to share it if anyone wants to listen to it. It's an audio recording of the briefing that Merseyside Keep Our NHS Public did for the Liverpool MPs. You're welcome to have that, slightly dated now because it's before this latest lockdown, but it goes through all the stuff about the CCGs in detail. And we want people to understand it. Nobody understood what was happening when the elder care was privatised under Thatcher. No one realised that was what was happening, yet it happened. No one realised what was happening with mental health, but it happened. I mean, you might remember that our local, the Childhood and Adolescent Mental Health Service was given from the NHS to Barnardo's. And this was when I was still teaching, and they were convinced that all the staff would stay, and the staff just went no way and were off. And the whole service was in a terrible state, is still in a terrible state. So yeah, because you don't understand it, because it's not being explained to you, don't think it's not happening. And what we want, what the campaigners want from the Trades Council, from Save Liverpool Women's Hospital, from all the other health campaign groups, is we want people to begin to understand it. And we'll talk to you about it in as much depth as you want to listen, and for as long as you want to listen. But we are on the point of losing so much that our campaign is going to have to be for renationalisation of the NHS. We've got to keep saying the NHS is still wonderful. It's still a wonderful organisation. You know, if you compare the death rates amongst women giving birth in Britain and the USA, you've got to keep the NHS. The NHS is magnificent in that respect. It's not good compared to the best. You know, it's not even in the top 10, but it is fantastic, and it's a brilliant system that we've got to try and protect. But people need to understand what's happening and quite how the money is being siphoned away from the NHS, and how that will lead. If you end up with your hips gone, you still need to go to work. You're going to end up paying the £8,000 to get it done. But if you're poor and you're unemployed, you're not going to be able to pay it. So we'll end up with a two-tier system. And you think that can't happen? Look at dentistry. If you, like me, you go to a family event, a family funeral, and you see cousins you've not seen for ages, you can see who's hard up by their teeth, because dental care is no longer universally available to people. Mental health says it as well. Elder care. Most people know of the horrors of trying to sort out who's going to pay for what bit of elder care, which bit is medicine, which bit is social care. Medicine you're supposed to get free, social care you're supposed to pay for, means testing and all the rest of it. We've got to keep the NHS, and that's going to take a campaign that matches what was done in the early part of the century and the demand for the early part of the last century and the demand for the NHS. And Adam said, how do we win it? Well, I mean, I personally think that last election was very strange, very manipulated by the media. And, you know, I mean, I'm not in the Labour Party, but I was campaigning for the Labour Party, I was knocking on doors for the Labour Party, and not enough knocking on doors had happened, not enough stuff of going deep into the communities had happened. If we're going to win this, we've got to go so deep into the communities. I mean, I know people who were, you know, part of the women of the coalfields, the miners' wives, the ones who fed the people in the areas, who were too scared to go and put a Labour stall up in some of the towns. Such was the vitriol. But things are changing, and we either give up or we say, okay, let's launch this campaign for the NHS to make it, you know, like no other. We'll, you know, match what the others do.
Yeah, I've got a couple of more things here for you, Felicity. Number one, please send me the recording. If you send it to me, you've got my email number. Yeah. I will distribute it to the people who actually want a copy themselves, and I will ask someone to actually put it on YouTube for us and for the many Mondays. There's also a couple of other things here. Question from Clive. Clive worries about the idea of integrating social care with the NHS. In his experience, acute treatment often gets priority call on budgets. At least while local authorities control social care, they can prevent acute care top slicing or siphoning off because it's sexier than social care. That's his comment, and I'd like you to talk about that as well as what you were just talking about before, national campaign, is by saying, what do we want the national Labour leadership to do? And I won't repeat what Peter and Lisa have said. Up to you, Felicity.
Well, I can say what I like. I'm not in the Labour Party.
Quite all right.
There's a number of reasons why I agree that it's not right to integrate health and social care. First of all, it's the fact that social care is supposed to provide for people's lives, to allow people to exist. You know, if you've got a physical disability and impairment, you're not sick. You shouldn't have your life medicalized. You should have a say. You should be having a say in how you need support and what support you need. That's very different from medical issues. I also think that social care is means tested at the moment. It should stop being means tested. We should have it using an NHS model. But at the moment it is means tested, and the more they can push into social care, the more we will have to pay. So it's very dangerous to have social care in that way. The other thing is that a lot of people don't realise is that social care, especially elder care, but also the care of people with long-term mental health issues and long-term learning disabilities, most of that is owned and run by private companies. Now, those private companies started off as little, the local GP setting up a care home. They're now owned by multinationals and by hedge funds. Now, any of you that are football fans know what a hedge fund is from what happened to Liverpool and Manchester when they were owned by hedge funds. But they actually speculate, not just on the buildings, but on their guaranteed income. So they end up loading huge amounts of debt onto those companies and then go bankrupt. We've got to clear them out of social care before we have integration with the NHS. I mean, I don't want integration anyhow, but that's the debatable point. But the situation with social care and the way that, care homes can just close, that's it, they just close, is really important. And talking of just closing, my big campaign is Save Liverpool Women's Hospital, which so far we've done. 5 years on, we've still got the hospital there. Merseyside and Cheshire STP commissioned through their CCGs, commissioned one-to-one maternity, a private company delivering maternity care, who went bankrupt, leaving women expecting a midwife at their house the next day to deliver a baby. Now, the NHS stepped up and actually stepped up magnificently and sorted that out. But we can't leave our healthcare in the hands of people whose priority is making a profit. It has to be a publicly owned, publicly delivered service.
What should the Labour leadership be doing then?
Well, I'm frightened of the Labour leadership at the moment because there are people directly in Keir Starmer's office who are linked to this whole project. Now, what we've got to be demanding of the Labour Party leadership is that they stick to the Bevan model. They demand a return to the Bevan model of the NHS and kick out the privateers. But Simon Stevens was a personal colleague of Tony Blair's. He then went after Tony Blair to work in America, where he became a senior executive in America and has come back to shape the NHS. Now, there's battles going on within the NHS. There's Stevens on one side and there's, I think it's Gove and Cummins on the other side, arguing about which style they'll go to in terms of privatisation of the NHS. But meanwhile, it's like a juggernaut moving on. We either accept that we're not going to have an NHS, or we've got to fight for it. And the Labour Party leadership is part of that. They've got to realise that there's huge pressure in the communities, and we've got to get it into the communities. We've done in Liverpool, we've done things like make sure that there's posters up on lampposts and all the rest of it, and tied to railings, just about what's going on in the NHS, because it's so hard to campaign at the moment with the virus. But we've got to keep campaigning on the NHS. And we've had, this is the second meeting we've done with this PowerPoint. Let's see, can we get 3-4 more, and see, can we get it down into Macclesfield, down into Crewe, into the other areas of Cheshire, so they also know what's going on. And let's see, can we educate as many people as possible about what's happening, so people don't end up saying, what happened to our dentists, what happened to our mental health services, what happened to our elder care. We've got to get the idea out there.
So one of the things which you did in Liverpool was to put posters on railings and what have you. would you suggest we did that in Chester? Because someone's asked, what can we do?
Well, it's a very simple little thing, isn't it? Yes. What we've done is we've done, I mean, Leeds have done a similar thing. Leeds have done it by getting banners, you know, about 3 foot long plastic banners that they tie up in the different areas. They tie onto various structures in the different areas. We've done it with laminated posters that we tie onto lampposts and things like that. Whichever way you do it, you know, the idiots, the 5G idiots, they got their message into the streets. We've got to get our message into the streets as well. It's that vital, that serious, that we make sure that, you know, there's a public demand for a proper NHS with properly paid staff, with proper hours. If you saw the number of staff who've been sectioned, who've been working in acute care during the pandemic. We've broken the mental health of some of the nurses that have been working in that situation. You know, we can't let all of that, all the sacrifices they've made go at this point. And yet, you know, I find it literally makes me want to vomit that they have been planning this further step of the budgets going to the STPs when they should have been planning how to deal with the second wave of the pandemic. And instead, you know, they've had these meetings, they've had all their staff working on this integration model rather than on the pandemic, which, sorry, gets
Carry
me
on the
angry.
question of the posters and what have you. Are there templates which we can use, or
We'll
do we
send
just
you,
make up our
I'll
own?
send you all that we've got.
I'd be very, very delighted if you could do that, Felicity. And I've got another question here for you, all right, very quickly, is that Tommy has actually asked, he said, did you say that CAMS is now run by Bernardo's?
It was. I don't know who's running
Okay.
it now, but it was. When I was a Senko, I was the Senko at Whitby High School. When I was the Senko, it changed from being an NHS run service, which was fantastic. They were amazing people, stunningly good people, to this, you know, the service before I retired, the service was down from, we could call on fully qualified psychiatrists with real experience and real knowledge to the kids, even with the most severe difficulties, could have 4 appointments. And that was it. You know, the cuts in CAMS. And I like to say about childhood mental health, if you think about a child getting diabetes when they're young, they learn how to deal with it. They manage it as part of their life. If a child learns to deal with mental health issues as part of their life with very supportive adults right from the beginning, their anxiety levels are reduced and they are much more capable of leading a fulfilling and happy life. But we've taken that away from them. It's gone.
Well, when I was a teacher in Liverpool in the 70s, 80s and 90s, we had, I can't call them trick cyclists, child psychologists who were attached to every school. And they did an absolutely fantastic job. I've been out of the profession now for a long time. I've been told that it doesn't happen any longer, which is not only the erosion of the National Health Service, but also it's an indictment on the education system as well. But that's another question. We've had some answers of what we can do in Chester. Is there anybody else who would like to ask, well, we got Felicity here, a question? All right, and I'm saying that because Vicky's got a hand up, you see. Vicky.
Thank you for letting me in again. It was to do with that My Choice list of so when somebody wants an operation, they can be presented with a private list. And I think what is happening, especially with COVID, causing a lot of delay in the waiting lists, is with foundation hospitals can make 80% of their budget from private. So this is happening now, the 2-tier system, I think. they can say, okay, you can go on the waiting list, or you can have this done privately with the 80%. So this is nothing to do with the STPs coming. This is what's happening now. And then going forward with the SDP, I think what's important to understand is that this is another structural change, allowing it to go beyond what we even know now. Once it's gone like that, it really has gone. That is the point. These things are happening now, these different types of privatisation that we're talking about, but come the 1st of April, and although they're operating on this whole budget population now, it's going to be even worse. So, time's so crucial. And I suppose what will happen is it might come into being, and then we've got to fight for it back, for renationalisation, I think, like Felicity was saying. So our fight, this is my question, our fight might not be timely enough to stop it happening on the 1st of April. So we're then into a fight to renationalise it, like the railways and things like that, to bring them back in. Maybe that would be the nature of the campaign. That's a question.
Felicity.
I think that we will be fighting a kind of rearguard action on everything, every issue, that if they try and introduce charges on a particular operation, then we'll have to have campaigns on that. But yes, if it goes through, then we will end up having to have a campaign for the renationalisation of the NHS, for the return to the Bevan model. But that will only work if we can get thousands of people to understand what's happening and why. Now, we know from the clapping and all the rest of it that people genuinely value the NHS. And even Tory voters, I mean, you're Chester, so probably you all stayed in Chester for the election work, but I was doing some work in Southport. We were running stalls for the NHS in Southport around, but vote for the NHS in the election. And the Tories who came up and talked to us, sometimes politely, sometimes very rudely, all believed that the NHS was safe with Boris Johnson. Now, you wonder where they get it, but he said he would make it safe. He said he would have his 40 new hospitals. He said all of those things, and they chose to believe him. They've seen, hopefully more people have seen how rubbish that is. But we can make the NHS an organising point in our communities. There's got to be other organising points. There's got to be stuff around jobs. There's got to be stuff around the Green New Deal. There's got to be stuff on a number of things, but the NHS is desperately important. And we really have got to make sure that we campaign and we stop this ignorance. I don't for a minute think that all the councillors want this to happen. They just don't think it's happening. They just don't believe it's happening. And I mean, I went to the Health Scrutiny Committee, I've forgotten exactly what it's called, in when people had real life meetings about 2 years ago, when the STP ideas were first being launched, and I spoke as a member of the public, and I explained what was happening, explained what the situation was. I was just met with blank stares. It was as though I was talking about, little green men on Mars. And then you had things at this healthcare scrutiny meeting where the woman who's the accountable care officer, interesting that Cheshire West say they don't have them, but they've got an accountable care officer on their on the healthcare scrutiny committee, was saying to people, I think Celia was there as well at the time, that we don't need more hospital beds in the NHS. People have got to realise we don't need more hospital beds in the NHS. This was at a time when the Countess was bursting at the seams. And yet she was standing there, nobody pulled her up on it. It's up to you councillors to explain this to your members. Nobody said, I mean, it was bizarre. People literally do not know. They're like going in, not knowing what's going on. But if you want to follow it up, check my facts, check my details, look at Keep Our NHS Public, look at loads of different campaign groups, and look at what happened to the Windrush people who'd worked in the NHS, worked for this country, because they didn't have a renewed passport, were denied care, and some of them died because they were told they couldn't have NHS care. And I mean, my big thing at the moment is trying to make sure every woman can get full NHS care if she's pregnant, but you don't. And you know, we've still got lots of migrants who will not go and will not risk it, because they'd lose, you know, they could lose their visa if they end up owing the NHS a lot of money. And you'll see posters like that up in the hospitals if you look. So we've got, you know, we've got a very dangerous situation on our hands, but I'm not pessimistic about it. We can do something about it.